There's this issue of the no COVID pandemic Royal Commission. There isn't one because Anthony Albanese and his cohorts are protecting Labor premiers. And that's clear. There will be, quote, an inquiry into the handling of coronavirus. It hasn't got the investigative powers of a Royal Commission. But before the election, Mr Albanese said there needed to be a Royal Commission or, quote, or some form of inquiry. A month before the May 22 election, a Labor-dominated parliamentary committee recommended, quote, a Royal Commission be established to examine Australia's response to the COVID-19 pandemic, to inform preparedness for future COVID-19 waves and future pandemics, unquote. The opposition health spokesperson, Anne Ruston, was right when she said in the absence of the states and territories being compelled to participate, it looks like nothing more than a protection racket for the state premiers. Well, then you have that ACT Senator Katie Gallagher in the exalted role of finance minister. She should be out of a job over the Brittany Higgins affair, but now she's running for cover, arguing the reason there is not a Royal Commission is that, quote, a fair bit's changed. Well, you wouldn't trust these people with your lunch money. Even the Health Services Union Secretary, Gerard Hayes, has argued that the actions taken, quote, by all levels of government should be looked at. But the actions of state governments are removed from the inquiry's terms of reference. Will an inquiry answer this question? Are the regulatory agencies that banned ivermectin funded by the very pharmaceutical companies who got approval for AstraZeneca, Pfizer and Moderna? Well, one man lost his job and has his reputation trashed in all of this. And what we now know, Craig Kelly, the then federal member for Hughes, was most probably correct on all fronts. He was cancelled, I was cancelled. He produced proof of the effectiveness of cheap drugs like ivermectin, banned then, yet now miraculously approved by the Therapeutic Goods Administration. I repeat, were the Therapeutic Goods Administration, which advises the government to ban ivermectin, was the TGA funded by the pharmaceutical companies that produced AstraZeneca and Moderna and all the rest of it? Was ivermectin a threat to their products? And did Australians pay a high price, not just for the ineffective vaccines that cost the taxpayer billions, but for being denied access to drugs like ivermectin, a little tablet? I will keep asking, are these regulatory agencies like the TGA funded by the very pharmaceutical industry that they are sworn to regulate, yet give approval to one treatment, vaccination, and no approval for another, an ivermectin tablet? Craig Kelly was vilified and called a foghorn of ignorance. In one of the many interviews I conducted with him at the time, he cited an open letter from a raft of distinguished UK doctors to the Chief Executive of the Medicines and Healthcare Products Regulatory Agency in Britain, which is responsible for ensuring that medicines and medical services work and are acceptably safe. The letter of several pages expressed concern that coercion being exercised to accept a certain medical treatment, namely vaccination, was against UK and international laws and declarations. The New York Post earlier this year published a series of analyses by highly respected researchers who have exposed the truth about public health officials and their government masters during COVID. And as the New York Post reported, most of the time they were wrong. The public health officials, along with their government mouthpieces, propagated misinformation that ruined lives and forever damaged public trust in the medical and political professions. And only in the last fortnight, we have the Office of National Statistics in England revealing that 69,466 people had died within 28 days of being vaccinated, and 178,874 died within 60 days of being vaccinated. That is, injected with the Wuhan coronavirus vaccine that was made compulsory here.